Welcome back to my YouTube channel, and on today's episode of Nurse Clemens B, I am going to teach you medical instruments as common instruments that is being used in nursing, forceps and some instruments that are commonly used in nursing. So today we are going to do instrumentation. So sit back, watch this video to the end. Do not forget to like, share and subscribe to my YouTube channel, and also comment and let me know also if you want me to do any procedure and upload it on my YouTube channel. Please just drop your comment also there. Thank you for always supporting me. Thank you for watching my videos. Thank you. I love you all. Thank you. Do these instruments one after the other. I'm going to tell you their functions, so sit back and watch. As you can see, this one, it's called needle holder. So this is needle holder, right? So do not forget to confuse yourself with it as in artery forceps. No. As you can see, they have two different tips, right? So you see this one is an artery forceps, but I'm concentrating on, you see they are almost the same. They have clip in between. They have both clips, right? They have clips. So you may mistakenly say it's artery forceps, but it's not artery forceps, right? So now look at it very well. Look at in between. So when you want to know the differences between needle holder and artery forceps, open the forceps this way and look at the middle. You will see this line in the middle, right? Where as you place the needles during suturing, if a surgeon, nurse or doctor, they want to suture, they'll place it here and it will just clip and hold it in place. So, and it always have this space, this tiny space here, so that you can hold the needle, right? So this is called needle holder. Function. The function of this is to hold sutures during surgery, so that you can suture the muscles, the skin, tissues. That's the function of a needle holder, just to hold a suture, right? Sometimes they come in different sizes, you can see, right? Next is dressing forceps. So this is what we call dressing forceps. Remember, look at this and also look at this type of artery forceps. You may think that they are the same. No, they are not the same. So this is actually dressing forceps. As you can see, it doesn't have a clip in between it like the artery forceps, right? So like this is artery forceps. It has a clip that you, after holding a bleeder, you can clip it, right? But this one is a dressing forceps. So you use this forceps during wound dressing, right? So you pick a gauze and hold it this way, round it around the forceps, and then it is being used during dressing of wounds, right? Basically dressing of wounds. So you wrap the gauze this way, and then you dress wound, you clean this way, and then you clean this way. So this is what we call dressing forceps. I hope you understand. I hope during exams you don't have issues. Do not confuse yourself with this dressing forceps with artery forceps. So these are called dissecting forceps, right? These are called dissecting forceps, these two. One is toothed. Look at this edge. Look at this edge. It has a tooth-like that you can easily hold something or pick something, right? So, and this one is plain dissecting forceps. So look at the two. This is plain and this is toothed dissecting forceps. So this one is being used to pick debris inside wound during wound dressing. For example, if there are dead tissues, you want to pick some dead tissues from you can easily, and it will hook like this, right? So you can easily pick some dead debris, dead tissues from the wound, and then you pull it up. And the plain dissecting forceps, you can use it to pick gauze, you can use it to pick cotton wool for dressing, right? During dressing, you want to use the dressing forceps, right? Yes, dressing forceps. You use this plain dissecting forceps, pick the gauze this way, and then wrap it around the dressing forceps, right? Wrap it around and then sometimes it even helps you to squeeze excess solution from the gauze, right? So you can use it to pick gauze, right? And also you can also use it and also pull it out after when you are done using the gauze, right? So these are some of the functions of plain dissecting forceps and toothed dissecting forceps. Next are my artery forceps, the forceps that clip the bleeders, right? Artery forceps are forceps they are being used during surgery to clip bleeders like the veins, right? The veins and the arteries. So during surgery, whenever they are bleeding, maybe they are being cut and then they are bleeding, you can use it to clip the bleeders with it. So for artery forceps, for this type of forceps, right, we have different sizes. We have this one, it's also been known as mosquito cuff artery forceps. As you can see, it's been named cuffed because the edge, the tip is being cuffed this way, isn't it? So it's called mosquito cuffed artery forceps, right? And this one is called straight mosquito artery forceps. All of them are artery forceps, and this one also is called straight long artery forceps, right? As you can see, straight long artery forceps. So look at them. All these are artery forceps, right? So depending on the size of the bleeder, the surgeon or the nurse can use it to clip the bleeder. If the bleeders are just small, tiny bleeders, you use the mosquito artery forceps to clip them. While if the bleeder is big, of course, you use the long, straight artery forceps to clip the bleeders, right? So students sometimes find it difficult to know whether this is an artery forceps or not. Yes, I will tell you, this is an artery forceps too. The only difference is this space in between, right? This one doesn't have any space, so it's called a robot artery forceps, right? And sometimes some people are saying, oh, it's been named, it's also called Edward Spencer artery forceps, right? So this one is called robot artery forceps, right? It's also an artery forceps. It also have a clip. It's just that it doesn't have space like this one. It doesn't have space in between. So whenever it's closed like this, some students find it difficult to differentiate between this one and this one. But all of them are called artery forceps. Artery forceps of different sizes and different shape. I hope you understand. The next instrument is scissors, right? So here, the general name of these instruments, they are called scissors. They are all scissors here. Permit me to say scissors. They are all scissors around here, but they have different functions. Yes, this one, they are all straight scissors, normal scissors that you can cut skin, that you can open during surgery. The surgeon can use it and even open the skin more, right? And that's the function of those ones. And you can also cut gauze, cut gauze, and also if you want to cut some dead tissues, you can cut it. So these are normal scissors that you know, this three. But do you see this one? This is also called scissors, but the name is called stitch removal scissors. Let me place it this way. Can you see this sign? Like half moon. Can you see here? Right? So this is called stitch removal scissors, right? So as the name implies, its own function is to remove stitch. After suturing, you want to remove stitches, right? So you can easily put this hook here and just pick it up and then remove the stitch and just hook it up this way and just cut it to remove the stitch. That is why it's been called stitch removal scissors. It's being used commonly in the cut sutures, right? So the next scissors that I have is episiotomy scissors. Episiotomy scissors is being used is commonly used in the labor ward during child delivery. For example, if a woman is delivering and then the vagina orifice is too tight and you want more space, the midwife uses her hand and puts this blunt space. It's been used to put inside the vagina and then cut, that is to do episiotomy, right? So this one is called episiotomy scissors, right? As you can see, episiotomy scissors. So the next scissors is what? Umbilical scissors. As you can see, this one is used to cut the umbilical during childbirth. After when you birth a child, you conducted a delivery as a midwife, as a nurse, you use the scissors to cut the umbilical, right? So the name is called umbilical scissors. Just look at the shape very well. Umbilical scissors, episiotomy scissors, right? Stitch removal scissors, right? And these ones are the normal scissors that we have in the hospital, right? The next forceps is sponge holding forceps. Thus, as you can see, the shape at the tip of the forceps might be different, like this, as you can see, right? But they are all sponge holding forceps. Sponge holding forceps, right? So the aim, the function of this forceps is for holding, for cleaning, as in scrubbing the body of the patient during surgery. For example, the surgeon may just use the gauze this way, wrap it around the forceps this way, dip it inside solution, and then scrub the body of the patient, right? Scrub the body of the patient. Or you want to perform by vulva cleaning, vulva swabbing, right? You use it also, clip the gauze this way, and then clean the vagina after child or after CS, cesarean section. Then you clean it, right? And then that's the function of this forceps, right? Sponge, do not forget, these are sponge holding forceps. Sponge holding forceps. Also, do not forget that it also have clip at the base. It also have clip, just like artery forceps. It has space here and it has clip, and where a holder here that you can place your hand to place your fingers, and then after placing the gauze, after wrapping it round, then the clip, right? You clip it, then it stays in place. The next forceps that is being commonly used in nursing is tongue holding forceps. All these are tongue holding forceps, right? As you can see them, they are called tongue holding forceps, right? As the name implies, it is being used to hold the tongue during surgery, or you can even use it, improvise it as means of holding the tongue, as when the tongue is falling back to block the airways of the patient. You want to put on airways, plastic airways, you can hold the tongue this way, you can hold it, and then after holding the tongue, then you pull it and place airways, right? So it helps also to during surgeries of the esophagus to hold the tongue, right? So these are called tongue holding forceps, right? They also have clip. Remember, as you hold the tongue this way, you clip also this way. You also clip it this way, right? So it also have clip like artery forceps or sponge holding forceps. So these are called tongue holding forceps. Yes, the next is a forceps is mouth gag. Mouth gag, this is adult size and this is pediatric size. This mouth gag, it is being used for opening the mouth of a patient, and an unconscious patient, right? Open an unconscious patient's mouth during oral care, right? So do not worry, I will do another video on how you can use this forceps, right? So this is adult size and pediatric size, and they are called mouth gag. The next instrument that is commonly used in the hospital, nursing profession or medical profession, right, in medical line, is the Gallipots. Gallipots, and they come in different sizes, These are all Gallipots, different sizes, different shape. As you can see, this one is big, small, and medium, right? And they have covers so that if you put any solution or spirited swab inside, you can easily cover it, right? This is called all these are called Gallipots. Gallipots. So do not be confused whenever during exams an examiner places this during OSCE, they place this and ask you to identify what's this, and you say you don't know. Of course, it's called Gallipot. This one, same thing, Gallipots. This one, together, not minding the sizes, they're all Gallipots, right? So it can come with cover. You can decide to cover them during procedure, depending whether it's sterile or clean procedure. So you can decide to cover or leave it open. The next commonly used medical instrument is the receiver or kidney dish. These are called receivers or kidney dish. Not minding the size, just as the shape is, as you can see, that this is the shape of a kidney. That is why the person that discovers this name it kidney dish. So this is called kidney dish. All of them are kidney dish. They are being used during wound dressing, during surgeries, during delivery. So this instrument is commonly used in the hospital. Nurses use them, doctors use them, lab technicians use them. All of them, they use them, right? So all of them are called kidney dish. This one, small kidney dish, medium size, and large kidney dish, right? So all these are called kidney dishes. Yes, the next instrument also we use in the hospital in nursing is sputum work. Sputum work, as the name also implies, it is being used to receive sputum, most especially for patients that do cough, asthmatic patients, TB patients, so that's tuberculosis patients, CCF patients, that is congestive cardiac patients. Yes, they place them, but you place it on the table for the patients to have easy access. They don't have to be like going in and out of their beds just to spit sputum. So you place this disinfectant inside, and immediately they spit in the sputum, they close it. That is why it has an inbuilt cover, so that immediately after putting the sputum, you cover it. And it must also always contain what? Disinfectant inside. The next instrument is Cheatle forceps. Cheatle forceps also always comes with its own stand this way. So a disinfectant and a gauze is being poured inside. Gauze will be placed inside, and then disinfectant, so that to always disinfect this forceps. So this is called Cheatle forceps, right? Cheatle forceps. So it is the function of this forceps is for you to pick sterile instruments from drums, right? So for instance, during wound dressing, and you wouldn't want to, of course it's a sterile dressing, sterile procedure, so you have to observe aseptic technique. So you ask your assistant, or you use this forceps to pick sterile gauze from the drum this way, and place it inside the receiver this way, right? And you pick and place it this way, so to maintain the sterility of the equipment or gauze, right? So that's the function of this Cheatle forceps. So for example, also if Gallipots are being sterilized inside the drum, right, you also use this Cheatle forceps to pick them up this way, and place them right on a sterile field.